Shamima lyali erinnya lyange tuliko TMR Golden Living. Leero tulina Dr. Charity. Dr. Charity leero agenda kwogera ku recurring infections ze tubeera nazo. Naye simanyi oba ekigambo infections kyavaawa. Doctor, how are you?
I'm fine, thank you.
You're very fine?
Yes,
You know how much I love you. You always look innocent.
I'm very innocent.
Very humble and innocent.
Yeah, very humble.
Eh? So how are you, Doctor?
I'm fine, thank you.
So, Doctor, abakyala tubeera ne recurring infections nga teziwona. Like, first of all, njagala kubuuza, where did that word come from? Because when I was growing up, nali siwulira kigambo infections. Like, I was hearing malaria, typhoid, ebyo. But I don't even remember us getting itching down there. I don't remember well.
Ekigambo infections just atabasawo tuizo kikozesa nnyo
Yes.
naye nga bw'ofuna kale ngambe bacteria oba virus negenda mu mubiri wetalina okubeera nekulwaza oba olina infection. Kati infection esobola okubeera anywhere. Infection mu matu, infection mu bulago, infection mu liiso, n'olwala luyinza okufuna infection. But each part of the body tulina amannya getuwa those infections. Okay? Like for the eyes tuyinza okugamba conjunctivitis, for the throat tugamba pharyngitis. Naye ndowooza abasawo tufuuse mulezi.
How?
We just say infections. Natakugamba kale omwana alwadde alina infections. Infection ki? I want to know, is it a middle ear infection? Is it a throat infection? Is it an intestinal infection? Infection ki omwana gy'alina. That is why it's nice for doctors okukebera omuntu. They take a history. Etuyita history. N'obuuza omwana yabadde ki, alwadde ki, abeera atya, akola atya. Then n'okebera. You examine.
You don't just assume.
You don't just say, yingira. Kyekikuluma omutwe gunnuma omugongo buki olina infection.
Typhoid.
Genda yeah. Kati ekigambo infection tugikozesa bubi. But it just means that there's a part of the body that is like waliwo bacteria or virus nga nyingi nga zikufudde kale mulwadde okujja ne signs and symptoms ezo ezikuleese mu ddwaliro. That is why tulina okukebera to qualify the infections. That I just don't tell you.
So where did the itching of the vaginal itching
so now we are zeroing down
from?
on the vaginal infection.
Yes, because that's what disturbing
vagina
women. Because I don't remember us.
Okay, the vagina is now a body part. Now we are going to focus on the vagina.
Yes.
I mean, I'm a doctor for
for
women.
that, for women.
Vagina,
that side.
yes. So, so the vagina can get sick. And that's when we say that the vagina has an infection. So we call it a vaginal infection. But the vagina is part of the reproductive system. So it's just one part. There are other parts. There's the cervix, there's the uterus, what your tubes, the ovaries, the pelvis, yeah. Kati, any of those can be sick. But I'm talking about the vagina a lot because that's what will bring the lady.
Yes.
By now what? Vaginal infection. Ate ennaku zino, I actually picked this topic because ndaba nnyo abakyala bajjanga they say they have UTI. But urinary system is separate from the reproductive system. Zanjawulo. Okujjako nti ziri very close. They are neighbors. Kati ennyindo bw'erwala tujja kungamba nti omwo mulwadde because the nose is sick. So sometimes urinary system erwala and sometimes the vagina erwala. Sometimes erwala zombi at the same time. Sometimes because they are very close, ono alwala n'agabirako munne. And it's very important okubyawula because if you don't tosobodde kubyawula, you might not treat it properly. Yes. Okay. And that's the challenge we've been having. Kuba abakyala, they just come out UTI.
Anti yabawulira.
Sometimes it's not even
mutugamba UTI olumu nogamba candida. So what's the difference? Me having a UTI and then candida.
Okay, UTI comes from kiva ku urinary tract infection. Urinary tract infection mu system ya urine. System ya urine etandikira eno mu kidneys. Ensigo. Waliyo ensigo. Zifiltering omusaayi ne ziforminga urine. Urine nakkirira n'agenda mu kawago, the bladder ne storinga. Kati bladder ekuuma urine bwejjula n'ofuna ka sense ngende nkole susu. Then susu n'ayita mu urethra n'efulumya wabweru. Now that system can be sick without the vagina being sick. It can be an upper urinary tract infection, ngetandikidde eno ku ureters up to the kidneys, oba a lower urinary tract infection, tandikira ku bladder. Yes. But urine infection, for the layman, is infection ya akawago, ne the outlet ya akawago, n'ensigo rarely. Yeah. So typically ejja kuleeta symptoms like ofuuyisa kumukumu, omusulo gukubalagala, ofuka omusulo nga mutini, bugenda mutoyi nofuka nga kujja mutini naye ng'oguwulira gukuluma. And then bw'ogenda n'okola susu oba wakafuluma tonafuluma bulungi toyi owulira oyagala kuddayo. Tofuse gwonna. That is a typical urinary tract infection. Oluusi, is it worse? Fever. Can we say it's worse? Worse in terms of... Like, it is now high, or it needs attention? Yes, of course, ojja kuba uncomfortable. Weetaaga obujjanjabi. Oluusi weba erinnye waggulu eno ereeta fever, vomiting, very sick, ne pain mundira. Yes, that's typical urinary tract infections. Naye abakyala abasinga bafuna vaginal infections, which are different categories, ate showing in different ways. Kati mwe tufuna itching in the vagina, discharging ewunya bubi, nga color ekyuse, and then nga discharge eyinza okuba ebalagala, olususu, okulumizibwa, lower abdominal pain. Yeah, I've said itching. Yeah. So that vaginal infection can be different from urinary tract infection. Yes. But ekireeta vaginal infections byebyenjawulo, mwe muli candida. Candida yaleeta vaginal infection. Candida is a type of vaginal infection. Kati oyinza okuba ne vaginal infection nga ya bacteria, muli trichomonas, mwe muli the sexually transmitted infections, gonorrhea, chlamydia, syphilis, nezireeta candida, nezireeta human papilloma virus, kireeta cancer, bwe bityo nezireeta warts, obusundo. Yes. Waliwo abakyala bafuna obusundo. Yes. Warts, obusundo. Because of the infection. Kati infection with human papilloma virus, yesobola okuzaala ki? Obusundo. Bubeera munda mu vagina oba wabweru? Kungulu, munda, anywhere. That's why ekikulu nnyo okukola ki? Okukebera. But women fear to go for these checkups. They fear the results. They fear the outcomes. Kati okutya outcome tekikutaasa. You'd rather know and treat. Nfunye nnyo abantu bangi nga bagamba, I'd rather not know. Like, ne batya okukebeza kansa omwagana baana kuba tebaagala kumanya. Anti atya okufa ng'alaba. If you don't check, ojja kutuuka ekiseera ng'olwadde ng'olina okukebera, oteekwa okukola ki? Okukebera okufuna obujjanjabi. And yet bw'okebeza mangu, okijjanjaba mangu, ne kiwona mangu. Yes. Twali tufuna nnyo obuzibu nga bamaama bajja leeti, bajja baswala okwogera nti nina ekikulukuto
Eh.
when you're an
Anti
old
ne fear
woman
y'okukebera